Yes.
Good morning. My name is Hannah. I'm going to be your nurse for the day. I'm just going to go ahead and do some hand hygiene. How'd you sleep last night?
Well,
How's your visit at the hospital been?
it's been good.
Okay. So what I'm going to do is just a basic head-to-toe assessment on you. Just assess your heart and lung sounds. Make sure everything's looking good.
Okay.
Do you have any questions about what I'm going to do?
Mm-hmm.
Okay. I see you don't have any visitors. I'm still going to close the curtain just for your privacy. And the door is closed as well. Okay. So, can you go ahead and state your name and date of birth?
Yes, it's Tom Richarde, 9/16/72.
Okay. Any allergies?
No.
That all matches against the medical record. Next I'm going to do you know where you're at right now?
Yes, I'm in the hospital.
Do you know what month and year it is?
It's December 2020.
And who is our president?
Donald Trump.
Okay. Patient is alert and oriented. Speech is clear and coherent. I see you're not having any issues breathing. Is that correct?
No.
Okay. So let's go ahead and get started with the assessment. I'm first going to take your vital signs.
Okay.
Right. Go ahead and lift your arm for the blood pressure cuff. There's your pulse ox. And open your mouth. Okay. While that's all going, I'm going to take your pulse. Your pulse was 75, which is normal and within ranges for your age group. Temperature is 97.6, which is also normal. I'm going to go ahead and take your pulse ox off. That is 98% on room air, which is awesome. And go ahead and take your blood pressure cuff off, which is in that red 130/76, which is what you've been running and within your age group. While I was taking your pulse, I monitored your respiratory rate. That was 14, which is also in normal ranges. Okay, are you in any pain today?
A little bit, just, I think it's from the surgery.
Okay, so in your stomach right here,
Yes.
is it radiating?
No, I don't think so. I think it's just like your normal post-surgery pain, you know, like it's like you've been cut.
Okay, and is it like stabbing, tingling? No?
Yeah, like stabbing, the tingling thing, you know.
Okay.
Yeah.
And on a scale from 0 to 10, 0 being no pain and 10 being the worst pain in your life, how would you rate it?
Like a 3.
And has the pain medication we've been giving you helping?
Yeah.
Okay, well I'll check your chart and make sure that we get you your next dose and that we reassess your pain often.
Okay.
Alright, so I'm going to go ahead and get started with the assessment. I'm going to work my way up, down. So
Okay.
first I'm going to inspect your head. Go ahead and lift up for me. Any tenderness?
No.
Okay, I don't see any lesions forming on the scalp. Skin is pink, warm, and dry. Okay, next I'm going to look at your eyes, so just look at me. And on this side. Okay, look at my pen light. Okay, pupils are equal, round and reactive to light, and accommodation has been noted. Pupil size is about 3 millimeters, so that's all within normal ranges. Your sclera is white and conjunctiva is pink and moist. Next, I'm going to look at your nasal cavities. Any trouble breathing?
No.
Nose? No congestion?
No.
Nasal mucosa is pink and moist. Any issues hearing?
No.
Okay. I don't see any obstructions in there, so that's good, and no lesions. Same on this side, so bilateral. Go ahead and open up your mouth and say ah. Alright. Any pain or tenderness in your mouth?
No.
And do you have dentures?
No.
Okay. And no bothering with your teeth?
No.
Okay. Any difficulty swallowing?
Not that I'm aware of. No.
Okay. I also noticed your mouth was pink and moist as well. Go ahead and swallow for me. Okay. Alright. Next, if you could just take your gown off so I can assess your heart and lungs. Alright. I'm going to listen to your lungs first, so whenever I move my stethoscope, take a nice deep breath in and out. Right? Your lungs sounded clear, not diminished, And like you said, I didn't notice any issues with breathing, and that's like what you said as well. All right, I'm gonna listen to your heart. You can just breathe normally. All right. Your heartbeat is strong, is to be expected. Are you having any chest pains? No. And no coughing, right?
Right.
Okay. All right, and now we're gonna move down a little bit to your abdomen. I know you said you're having a little bit of pain there. Have you noticed any extra drainage?
No.
No extra drainage, okay. And it looks like your dressing is intact, and we'll continue with the wound care as we go on. Next, I'm gonna listen to your abdomen. So just breathe normally for me. Your bowels sounded normal and what I expected. Are you having any discomfort down there aside from the obvious pain from your wound?
No discomfort at all.
Okay, I'm gonna press down. Let me know if it feels tender. Not gonna press too hard over here. It's not firm. I'm not seeing any distension with your bowels. Have you been able to pass gas?
Yes.
Yep. And when was your last bowel movement?
About an hour ago.
An hour ago. And are you having any issues urinating?
No.
No, not at all. Okay. And are you feeling nauseous?
Not too much. Maybe the first time I ate.
The first time you ate. Yeah. How's your appetite then?
It's been good.
Pretty good. You excited to move on to solid foods?
Yes, definitely.
Yes, we'll get you off that clear liquid diet. All right. So I'm gonna go ahead and we can cover you back up. Going to assess your upper arms. Okay, so let's go ahead and move this back. Move this back gently. Okay, I see you have an IV, and I'm just gonna check that the tubing does go up here and that it is connected and everything. Has this been bothering you at all?
No.
No, not at all. Doesn't look like the site is irritated or red. And we'll just keep monitoring that. Right? Go ahead. Any numbness, pain, or tingling in your arms?
No.
Okay. Skin is pink, warm, and dry. Okay, go ahead and put your hand like that. Take your pulse. Radial pulses are symmetric and bounding. Okay. Go ahead and put your arms out like that. Squeeze my hands. All right. Patient has good strength. You can let go. Okay. Can I see your thumbs? Testing capillary refill. That's brisk in under 3 seconds. Okay, go ahead and pull this down. All right, we're gonna do the same thing down to your legs. Okay, so I'm gonna take your socks off. And any pain, numbness, or tingling down here?
None.
None? Okay. All right. No edema has been noted. I'm just going to pinch your skin real quick. Okay. No tenting, so elasticity is what's expected. Dallas pulse is symmetric and bounding. And I'm going to check your capillary refill rate on the toes as well. This is brisk in less than 3 seconds. Now push against my hands. Okay. Push towards or bring your feet towards yourself. All right, good strength on both sides. It's symmetrical. So let's go ahead and put your socks back on. All right, so I'm just going to need you to turn to your side so I can take a listen to your lungs and assess the back. If you could take your gown off for me. All right, same deal with the front. Just take a nice deep breath in and out every time I move my stethoscope. Alright. Lung sound, clear and not diminished. Are you having any pain back here?
No.
Okay. Looking at all the pressure points, I'm not seeing any ulcers forming from laying down on the bed too long. Have you been trying to reposition yourself?
Yeah, whenever I
As much
get
as possible.
uncomfortable.
Okay. I'm just going to assess the back of the legs and the buttocks and groin region. Skin is pink, warm, and dry. And no lesions are noted on the heels as well. And we'll get you cleaned up later with the bath whenever we get to that point. So you can go ahead and turn back over. Alrighty.
Thank you.
So that's the end of our assessment. I'm gonna make sure your bed is all the way lowered. Your 2 side rails are up. Your call bell's right here. If you need me, just call and I'll come right over.
Thank you.
Alright, anything else I can do for you?
No, I'm good.
Alrighty. Well, I'll see you soon.
Thank you.
You're welcome. I'm just gonna do some hand hygiene. Pull the curtain back. And do you want your door open or closed?
Open's fine.
Okay.